Hey guys, so this is one of these cases where the doctor actually is a patient. I don't make a secret what happened. I just had a meniscal injury and surgery exactly 7 days ago. I went to California to one of the best doctors who specializes just in meniscal tears and repairs, Dr. Solomon. He took a great care of me. I'm really pleased how everything went. So now I have to use this device for next 6 weeks. That means I have to walk with the brace every time I want to get from point A to point B. And I don't like it particularly because it makes you walk a little bit odd. You cannot bend your knee at all, but it's better than using crutches, for example. So I'm glad that I can actually walk instead of trying to get it by with crutches or some kind of walker. The problem is that when you cannot bend the knee for so long, the muscles start to atrophy because you don't use them. So I've noticed even after 1 week not being able to walk like I used to and flex my gastrocnemius and other muscles, they actually start to atrophy. So what I'm doing now is called the Flex Max. This is one of the devices that one of the functionality we do have here. So if you look at the screen, it's EMS. It's very sophisticated electric muscle stimulation. So I have 4 electrodes right now. Look here, applied and being stimulate all these muscles, 1, 2, 3 behind, and the 4th right there. They're being stimulated. The good thing about it, I don't have to flex my knee, but the muscles are being utilized, they are contracting, and the hope here that I can prevent the atrophy that probably will get worse over the next 5 weeks until I'm able to walk again. Again, this is a beginning. That's my journey after having a sports injury, shattering my lateral meniscus. And you've seen me being in the hyperbaric chamber. But this, again, something that we can offer here. If you had a muscle injury, back pain, any musculoskeletal problem, the most important thing is to keep your muscles in shape. Once the muscles are weak, all the problems of wear and tear starts. Okay, so even with diagnosis of back pain due to other problems, you can still benefit from electric muscle stimulation. We can apply it very targeted. With the back pain, we can target paraspinal muscles right around the spinal column to strengthen them. And here, that's another example of what could be done to minimize postoperative atrophy of the leg muscles.